A total testing treatment on himself. Knowing may help others with the race disease. A total case to understand is one rare disease linked to test experimental treatment on himself. A total case to understand is all rare disease linked to test experimental treatment on himself. And they may have worked in the patient Dr. David Falkenbaum, an assistant professor at the University of Pennsylvania Perelman School of Medicine, has been in remission ever since he feared on himself as the subject 5 years ago. No new studies suggest Falkenbaum treatment may help others with this rare inflammatory disorders known as Castleman disease. The new research showed that patients with severe form of the condition will have responded to previous therapies, may benefit from treatment that targets specific insignificantly per way in cell count. The PRKIKTOR pathway, the word published today, August 13, in the Journal of Clinical Investigation, is one of the 5 occasions with the lead author co-report. Falkenbaum is so patient in the study. The doctor case began in 2017 when Falkenbaum was dead at 25 years ago. Medical school suddenly feel ill is developed cell-phone lymph node abdominal pain, fatigue, and an erection. A small red spot is body, according to the report. Falkenbaum condition some worsened and began life-threatening. Falkenbaum was eventually diagnosed with Castleman disease, which is actually a growth of inflammatory disorder that affects the lymph node. About 5,000 people in the U.S. are diagnosed with some form of Castleman disease each year. Patients with Castleman disease may have a mild form of the disease with single effect lymph node, while others are abnormal lymph nodes throughout their body and develop life-threatening symptoms including organ failure. Falkenbaum had this more severe form, non-idiopathic multicenter Castleman disease (NCD), which diagnosed only about 1,500 to 1,800 Americans each year. According to the report, the severe form of the disease is similar to cerebral autoimmune condition, but like cancer, is also caused an overgrowth of cells, in this case in the lymph node. About 35% of people with NCD die within 5 years on the diagnosis. Although there is approved treatment on the Castleman disease, a drug called Sultimol, or patient response to therapy. Falkenbaum fell into this group. Non-existing therapies help in, and symptoms kept coming back during the 3.5 years after. In diagnosis, it was operated 8 times. Clue is lineage. Right before a flare-up, he sat expand in the number of immune cells called activity T cell is will integrate a lot of protein called BEFA, both of So these factors are regulated by TPE3K8KTMT or pathway. For example, hypotheses that a drug that inhibits this pathway may help with condition. He took to drug called serotonin with inhibits the pathway and already used to prevent organ rejection in kidney transplant patients. For example, as at an Indonesian study, for example, and Colin reported to other patients with NCD as no showed increased level activity T cell and VEGFA before the symptom flare up after treatment with sirolimus both patients also short sustained remission survivable patients because 19 months with us are relaxed or finder artists fear to rinse T cell, VEGFA, and TPTKIKTT or pathway to NCD. For example, say is estimated most importantly, this patient improve well in environment in TORs. This is question because it is as therapeutic charge for patients that respond to succinate. A drought new findings are promising. This study involved only 3 patients and larger trials will be needed to show that this drug in effective treatment for NCD. Sounds, Fargabum and Collins plan to start in clinical trials to test sirolimus in about 24 patients with NCD.